Good afternoon. Role of AI in research. So, this is the topic which we will be discussing today. So, myself, Dr. Ash, and I will be taking up this important and interesting topic with you. Revolutionizing research. So, basically, this happens to be very important for the researchers, for the medical faculty, and the medical students. As far as this topic is concerned, you are well aware of the emerging role of AI in multiple modalities of education and research. So, first of all, transformative technology and the transformation which the AI has brought about in medical research. That is very important. Basically, research starts with data, and we have to analyze data sets. So, there are these large data sets. How do we do it? If we do it manually, it is quite a time consuming and a laborious job. So, what is important? That AI plays a very important role in analyzing these large data sets. So, what indirectly it does, it accelerates our pace of work. It is not confined to any specific branch like oncology, gastroenterology, cardiology, pharmacology, pharmacodynamics, pharmacokinetics, or other forms of research. It is widespread across all the modalities. So we have this AI which simply helps us in analyzing large data sets. Lot of research already been having done, and then this will help us to come to a conclusion with a fast speed by fast analysis. So there are inbuilt programs, there are these mechanisms which help us in analyzing efficiently these data sets, complex tasks being simplified. That is the first role of AI as far as research is concerned. Now, after that, in discovery, now research is one part, discovery is another part, and we have to be very much aware of certain tools like the semantic scholar and the illicit, which help us in discovery and research. Now, what is there? We have to work on a project, we have to work on a research project, and we have to have the data, analyze the previous data. And these tools, especially the semantic scholar and illicit, they help us in searching millions of past papers on similar type of work or the work which we are doing, because there's a difference between search and research. Research is something which has been already done. So, by having a knowledge of something which has been previously done by the experts and channelizing and having a look at what they have done, that will help us in preparing our research topic better by analyzing large data sets and especially in extracting the key findings. What was the previous result? What was the result from so many data sets which we have? What was the conclusion? And that will aid us in our conclusion in the, finalization of a research project as well. So, in addition to that, that would be something positive. The data sets would be analyzed for key research gaps. If we have found that by analyzing these large data sets that there was a gap, there was a deficiency in the previous research, we can just work upon those facts as well. So that is an augmented function of use of AI in research, but we should be knowing the tools like the semantic scholar and other things which I mentioned. Then comes data management and analysis. So, how do we do the data management and analysis? There are these tools like Google AutoML. And what is their role? They process large and complex data sets into simpler results. That is very important and effective, because manually it would take us a large amount of time. Say example, going to the library, analyzing the previous research papers, having that offline methods. But online you can do it, say very fast. Your speed is increased thousands and thousands of times, and the process is more efficient, and you get data sets from all over the world, not only from your library or limited source. So that is very important. You have got larger data sets to analyze from, you have got a rapid processing mechanism, you have got the automation there, and these will help you in speeding up the processes and also augmenting, I must say, channelizing, and also helping in processing, making the process very simple in identifying the patterns as well as correlations. So it is very important that you would manage and analyze the data effectively, and AI will come to your rescue by analyzing the data more efficiently as would have been done once a human factor is there. This is also a human factor, but it is an indirect human factor while we have used human brain to the max to just derive the analysis in a better manner. Hypothesis and experiment design. Now, what is best part about the hypothesis and experiment design is what is your methodology and what is the research questionnaire. Sometimes we have got vague questionnaires, sometimes we have got vague methodologies which we do in research, as a result of which that say your articles are not well taken up. So in case you have got a good research questionnaire, that will naturally augment your quality of the research. If you have got a good methodology, that will naturally augment your, or chances of acceptance of your paper. So AI can suggest you better research questions, better methodologies, and that indirectly will help you in just getting your research accepted in a better manner. So based on the existing literature or data sets, and there are these labs like the Berkeley lab which use AI and robotics to automate. So it is not about manually doing something, it is automation, automated synthesis and testing. So AI will come to your rescue right from the beginning, from analyzing large data sets to the hypothesis and experiment design, which you eventually have to go through. Now, domains of AI in research. Now we just do papers, we just do research, and that's about academic writing and editing. So even after you have compiled your thesis, you have compiled your topic, what's important? You need to put it in a very effective manner. There should be no grammatic errors. The writing and the chronology of the things should be fine. It should make sense. So assistants like Paperpal and Grammarly help in refining, fine tuning, fine adjustment of your grammar, ensuring academic tone. It should be in line with the standards which are there for the various indexing agencies. So your academic tone, your citations, etc., also matter a lot. Your grammar matters a lot. So there is why the AI also plays a role. Now, specialized scientific breakthroughs. Now, say for example, there's a clinical condition and the prognosis of this clinical condition is not good, and you have got not that many effective drugs combating this clinical condition ABC. So what you do, you have to develop new drugs. Research is focused on new drugs. So why does the AI help? There are these systems like AlphaFold by Google DeepMind, which can help you in predicting newer mechanisms. So going back to the pharmacological aspects, how a particular drug affects, what is the role of the drug, what are the various mechanisms of, say for example, the development of this tumorigenic condition of this oncological case. So by just doing a research, predicting newer mechanisms in the drug development, that is very important. That's a hypothetical concept. As such, you have not developed a drug, but the AI can help you in predicting newer mechanisms to combat this clinical condition. So this is a very important role. The AI can go where your mind has not gone, and then with giving you a sort of an idea, you can apply your mind, do research on that product, and see whether it really benefits in real time. So that is the role of AI in discovery of new drugs. So this is hypothetical, which can just go into a practical mode. So that is very important. Now, drug design, as I mentioned, it is, sometimes we have got transformation of predictions. Now, say for example, there is this clinical condition, idiopathic pulmonary fibrosis, And it was seen that it affects quite a large population, and this is basically a pulmonology condition. And in 2025, a big achievement was done because a drug with both a target and a molecule was designed by AI for this clinical condition. There was not an effective drug till that date. So, transforming predictions, as I mentioned, in certain cases, we can just be one step ahead and then develop drugs for clinical conditions in which there has not been previously an effective drug or an effective drug combination. Now, about the diseases, what is important? There are certain diseases which have a slow onset first and then they rapidly progress. I mean to say, especially oncology, especially certain infective conditions, sepsis, they just can just accelerate at some point of time. And what is needed in certain clinical cases is there you have to have an early disease prediction. Say, for example, breast cancer in certain so many types, and in certain cases, in certain patients, we see that they attain an aggressive behavior, not seen so many atypical, so much of a issue with the types of breast CAs or any other malignancies. And I mean to say the course is very, very aggressive in certain cases. So if you predict the outcomes and predict these conditions from a very early stage, that's very important. Early disease prediction is where AI has an important role. So predictive models can identify various disease conditions. It is not only about, I mean to say, the oncological conditions. It is about some of the pandemics like Alzheimer's, dementia, wherein there is excessive apoptosis, and we have it's a global epidemic nowadays, and this is becoming a huge public health problem. So identifying the early disease prediction in case of Alzheimer's disease well before the clinical condition has set in, or the chronic renal failure or the chronic kidney disease CKDs. So we can what we can do by virtue of AI, we can predict the behavior as far as these things are synthesizing genomic data and longitudinal health studies. So that is very, very important as far as this thing is concerned. So, disease prediction, early disease prediction is something in which AI has got a significant role. And once we can predict the disease early, we can take early combative measures to screen the patients and not allow the disease to progress at a rapid pace or to go into the next stage. So, that is very important. Now, as far as oncology is concerned, AI can transform cancer diagnostics. So, one step diagnostics, AI enhanced imaging. Now, imaging, radiology, you have got this MRIs, PET scans, CT scans. But what is important, the role of AI in radiology, just they say that AI will be replacing radiologists, and that is true to some certain extent. Why? Because AI can help in predicting diseases, giving better results, giving better, I mean to say, uh, results, as well as if we compare a result from a radiologist or multiple radiologists and AI. AI can pinpoint accuracy, more sensitive, more specific in many cases. And then comes the expert view of the radiologist as well, which cannot be ignored. But it has been seen in many cases that the prediction, predictive values, the sensitivity and specificity by use of AI in diagnosis of radiological cases, not only oncology, is far better than what manually a radiologist can do. So that is very important. So again, there are these, we do mammograms, we do scans for thyroid malignancies, we do prostatic malignancies, and what is important, the AI reduces false positivities and identifies the lesions earlier. So say for example mammography in the diagnosis of breast CA, it has been seen that AI assisted mammography can screen better and predict breast CA at a very early stage. So that is the role of AI, emerging role of AI in screening, in radiology, in oncology, and we can be applying this role of AI in future other conditions as well. Molecular and genetic profiling. Now, genetics is very important in many conditions. Genetics is evolving as a huge branch now. The role of genetic counseling, the role of gene therapy, and genetic modulation and genetic modification, which will be coming ahead very fast. So there are many diseases which have got a genetic basis, and AI can predict tumor molecular profiles and genetic mutations directly from imaging, reducing the need for extensive biopsies. So now it is not that the biopsy is just a histopathological thing. So just we can add another dimension to these biopsies, and we can just get the patterns of the molecular profiles and the genetic mutations from patient data. What that does, that helps us in predicting genetic behaviors and genetic modulation wherein it is applicable. The genetics would not be applicable in all the cases, but wheresoever we can do a molecular and genetic profiling which is AI based. So better result outcome, lesser damage, and early detection. So that is as far as the diagnosis is concerned, as far as the early predictive behavior is concerned. Now, planning. What is important now? We have diagnosed the disease. Is there anything wherein AI can help you in the treatment? Yeah, that's more important. And these AI tools assess if tumors are responding to chemotherapy and identify characteristics related to survival. So this is a very important aspect. Chemotherapy, multiple protocols for different malignancies. So as far as that thing is concerned, we have to have these important things. AI tools can help in treatment planning as well. So that is very, very important. So as far as this thing is concerned, we have got the treatment planning also wherein the role of AI is there. Now, personalized treatment, same oncological condition in two different patients. Different patients respond different in a different manner. So that has been seen. The predictive outcome of the same disease in two individuals is different. AI is revolutionizing cancer care, especially by predicting tumor profiles and genetic mutations from imaging, as I mentioned, and enabling what is more important, tailored treatment. The same tailor for two different individuals will not stitch the same suit. So, in a similar manner, this treatment protocol should be tailored to an individual because so many factors come into being. Once the response to chemotherapy is there, different individuals respond differently. So, the AI can revolutionize cancer care by enabling treatment which is a tailored manner and based on individual data set, individual patient data set. So that is where specific personalized treatment comes into being as far as AI is concerned. So, what are the benefits of AI in whole of this research? So, you can see that the speed is there. AI can enable faster diagnostics and improve detection rates, and that can be done at speeds which is not manually or humanly possible if we do it as such. So, speed is one thing. Then the precision. There is a high sensitivity, high specificity which AI brings into being. So, personalized treatments are developed using multi-omics data. So precision is important. Accessibility. Now, accessibility AI provides affordable point of care tests for patients. So speed, precision, accessibility is very important as far as AI is concerned. But there are certain disadvantages as well as far as AI is concerned. And there are ethical considerations. And what can happen, AI can generate false outputs and that can mislead the researchers. So a researcher will be hallucinating. So we have to avoid the false outputs which can be there. And bias, incomplete data can lead to skewed results. So positive skewed deviation, negative skewed deviation that can occur. Academic integrity, there is important thing is that it is not a copy paste thing, but there are concerns over transparency in AI authorship practices. Somebody has done a work and the second person who does a research ahead just copies the data. So there are those issues which can come into being as far as AI is concerned. And having said that, we have to just see how we can use this thing legally, logically, and that is very important because there's a lot of overlap between the data, whose data it is, how much of a plagiarism is there, how much of a, I mean to say, things are available online, how much of a data you should have, I mean to say, the ability to look into what is privacy and all those things. These come into being as far as the role of AI in research is concerned. So things will be legalized more with the more use of AI ahead. And at this point of time, it is just growing, and there are concerns also which are growing, but there are benefits also, and we have to see that we can use this AI judiciously in our research. So I would be committed to guiding future medical professionals in understanding AI's transformative potential in enhancing patient care and research methodologies. Any queries, I would be welcome, and I hope that I have presented the things in a simple and a compatible manner. And I appreciate your attention, interest. Thanks a lot for your time.